You know, we said that there are two main types of health care. When we are talking about direct, there are two main types of health care costs. Then we talked about direct cost and indirect cost. And this direct cost is subdivided into two main types, which are direct medical costs and direct non-medical costs. Talking about the direct medical cost, we said the direct medical cost is when we'll be talking about money in monetary terms, that is the cash, the money we use to buy the drugs, that the money we used to pay for the hospital bills, the money for consultation fees, and so on and so forth. Also, we talked about the direct non-medical cost, as we were talking about the cost that is being spent, the cost that have been spent as a result of maybe we want to get food for the patients on the ward, or the relatives want to get the accommodation for themselves, and so on and so forth. And the other one, we talked about the indirect costs, talking about the costs that are not in monetary terms. Please, I'm trying to start sharing the slide here so that we can all see. Please, I'm coming. So I hope you can all hear me, please. Okay, so let me start sharing this. I'm trying to share the slide. Share. Study session 3. Please, can you see the slide now? The slide is displaying. Now, I think it seems we stopped at element of cost. Now let us, and I said this element of cost are 3, and I've mentioned them. Now let us move to the benefits from healthcare. What benefits can people get from healthcare? Talking about this, the types of benefit that individual that people receive from healthcare could be physical or monetary. They include relief from their pain, relief from their suffering, relief from their anxiety, and so on and so forth. Also, the benefit that can be gotten from healthcare is the benefits. They are the benefits in form of capital, good being capital being a monetary payoff measured by increased production. Talking about this, I think this network is kind of, I'm sorry for any inconveniences, please. That is the benefits from healthcare that people can get from the benefit that people can get from healthcare. Then we talk about relief from pain, suffering, and anxiety, and so on and so forth. That is, suffering, relief from pain can help an individual to improve, can help to improve health outcomes for the individual, for our patients on the ward, in terms of disease prevention and control, in terms of effective treatment, in terms of management of chronic conditions. It also helps to enhance quality of life. Also help with social benefits too, and protection from financial hardship, like we said here now, as benefits in form of capital, Capital good being a monetary being monetary payoff measured by increased production. Now, talking about economic appraisal in healthcare. Yeah, we say that economic this network, eh? Please, I hope you can all hear me. You can still hear me. Economic efficiency is relevant in healthcare because the resources that are used in providing services and programs are scarce. They are scarce. That is, we say that economic efficiency is relevant in healthcare because of what? Because the resources that we medical practitioners that we use in order to provide healthcare services to our and programs to the clients and the patients on the ward is because these resources are scarce. And since the resources is not since these resources are not and can never be enough to satisfy human wants completely, their use in one beneficial activity means that the community automatically forgoes the opportunity to use them in another beneficial activity. And expenditure on medical care is rising in both developing and developed countries. Not only in this country, Nigeria, also in some other countries, both countries like Nigeria that are still developing, and both countries that are already developed. Talking about USA, the expenditure on medical care in all the countries in all over the world, they are rising every day. When we say the economic appraiser, we are talking about the systematic assessment of the costs and benefits of health intervention to determine whether they provide value for money. So inpatient services are a large and fast growing part of all health service and expenditures. That cost, which alone accounts for about half the cost of all personal health care. And this together with the drug cost too. It's not only the bills that the patient pays on the ward that are high. Also, the cost of the drugs, the cost of medications are increasing every day. Also, you can also begin to imagine that the real cost of healthcare is much more than what patient pays in most public health facilities in developing countries. Also, to evaluate the cost of healthcare to the society rather than to the other reason why this economic appraiser is being taught in schools, that this also to evaluate the cost of healthcare to the society rather than to a category of users. The money spent on resources is not considered a good indicator. So this expenditure might be artificially high, owing to high taxes or profits, or artificially low, owing to subsidies and grants. Economic efficiency in healthcare can be defined as the provision of necessary care of good quality at minimum cost. Please let us take note of this. You can see that I put it in bold form. It is in bold. You can see that it is bold. It is in bold ink. That is, economic efficiency in healthcare is referred to as the provision of necessary care of good quality at minimum time. That is, at minimum cost. That is, talking about economic efficiency in healthcare, it means the provision, how the necessary care that an individual, the family, or a community at large, what the necessary care they need, the means by which they are being providing to them, the means by which the healthcare givers are providing this necessary care to them. This necessary care, the necessary care of good quality, how they are being provided to the community at large at minimum cost, at a cost that is not high, at minimum cost. Now, therefore, the aim of this economic efficiency is to move towards a better economic balance of services, and also to eliminate ineffective, also to eliminate excessive, and also to eliminate unnecessary medical procedures. So many economic factors are beyond the control of health decision makers, But one major well within their power is to curb the growth of high-cost programs and services for the few and promote low-cost services, which by using less expensive primary healthcare personnel, which will reach a much larger proportion of the community. That is, you cannot another means by which this cost can be given at minimum level is that if the government can help for the people in the community, can help the people in the community instead of them to be going to tertiary institution, we can recruit, the government can recruit as many as healthcare workers at primary level. That is, they will be the one to be very close to those people in the community, to those people in the rural area, in the remote area, so that these people will not have to be spending, let's say, fees on transportation again. It's only if their treatments require referral that they can be referred to tertiary institution, and if it is beyond the power of those in the tertiary institution, they can refer them to the specialists in tertiary institution. So by doing this will help to reduce the cost these people are paying. These people will be paid, that the people in the community will be paying to the minimum level. So it is also important to encourage cost awareness among healthcare providers in view of the scarce resources from both the private and the public. There is also a need to make consumers aware of these costs. Those people that are who are our consumers in healthcare system. Our consumers are our clients, our patients. It's also good to let us know. There is also a need to let them know, to let these consumers know that cost of health, to know the cost of health by being better informed. That is, you have to let them know how things are increasing, how the cost of all the bills and the medications in the hospital, how they are increasing day by day. On the choice, so also let them know the choices that are available in order to make decision on which type of the service they want to go for. I said that there is also a need to make consumers aware of the cost of health by being better informed on the choices available to them and the cost of the choices, so that they will be able to make well-informed decisions to save their costs, to save the cost. Now, what are the reasons for the present trend in cost of healthcare? We all know that the present trend is increase in the cost, increasing. They are increasing. The cost is increasing day by day, every day. So what is causing this increment? And the first one is demographic reason. Hello, please, I hope I'm not only talking to myself. I hope you can all see the slide and also hear my voice. Kindly let me know, please. Thanks so much, Charity Bioma. Thanks. Okay, let me proceed. Thank you. Thank you, Omalade. Okay, thanks. Let's proceed, please. Thank you. I'm grateful. What are the reasons for the present trend in cost of healthcare? The first one is demographic reason. Why do we choose this? Because there is population growth in developing countries. For instance, in Nigeria, you tell people to come for family planning, they will not come. They will say that it's because government wants to be killing them one after the other. So they refuse to go for family planning. They refuse to go to come to the hospital for family planning. As a result of this, there is increase in population growth in the developing country. To keep pace with this growth, in order to keep pace, in order to meet the needs of the people in this community, in these developing countries that we are talking about, including Nigeria, healthcare costs have to increase. Another reason is labor-intensive nature of health services, because we healthcare providers, our work is kind of it's kind of intensive. The work we do here is, if you see people in the hospital, if you see we nurses in the hospital catering for the patient, caring for our patients, even some of us in our hospitals, we don't only do the nurses' job, we don't only do the nurses' duties. we move out of our duty, out of our job description. We work, especially those that are working in primary health centers. You do the job of the doctors, you be the one to consult. You do the job of the of healthcare recorders, of what do we call them? The job of medical records, medical recorders. Also, you do the job of pharmacists. You be the one to be doing laboratory investigations for the for your patient too, where there is no one to do it. If you don't do it, it will affect your work. So you have to do it. Because of this intensive nature of our job, here the government is trying to make it up for us by increasing our salary, even though it's not enough. So healthcare is labor intensive, and there is limited scope for saving on labor costs in personal health services. So talking about we skilled people now, the nurses, we are required to provide health care. As a result of this, because they need skilled people, they will not go for the quacks to come and be working in government hospital. As a result of this, government, everything, this is one of the reasons why there is increase in cost of health care. I'm coming, please. So the next one is quality of health services. Advances in technology has improved quality of diagnosis and therapy. Unfortunately, the cost is often greater than the increased effectiveness that have been achieved. So try and think of the various equipment we use today as compared with those obtained some like 10 or 20 years ago. There are new equipment now in the hospital. So now, another reason is public expectation, what people are expecting, what they are looking forward to achieve, to receive from the healthcare facilities. People desire increasing standard facilities in health services. There is high demand for curative healthcare, while underutilizing preventive personal health service, particularly in developing countries. Instead of our people to be looking forward to preventive measures, instead of them to be preventing diseases that are preventable, they will not do that. But once it happens to them now, they will not be seeking for corrective measures. Now, let me give us an example. In Oyo State now, government in Oyo State, they are now distributing ICN, the nets, mosquito nets for the people. Now, some of our people will not use this. Some will say they cannot sleep under the net for so many reasons. Instead of them to use this net in order to prevent, or to use insecticide, or to cut the bushes around their environment, they will not do that. They will prefer to have this malaria and go to the hospital for treatment, where in the hospital we will collect money for the test, we collect money for their treatment. So that is another reason why there is this present trend in cost of healthcare. Another one is changing epidemiological picture during socio-economic development. Another reason is organization and structure of health system. There are situations where multitude of agencies, where they are financing and delivering parallel and uncoordinated health services with consequence of overlapping. This is much more in preventive healthcare services. Another one is extension of health services coverage. The attempt to extend the range, coverage, or impact of services to a larger population increase costs. There is no how. The government wants this health, this healthcare to spread to the remote area where some people, where our people will not be able, some people are not able to come to the city for treatment. They prefer to be taking concussion, herbal concussion at home. So government plan to extend this, to extend the healthcare to this remote area. Thereby, it's affecting the cost of healthcare because the cost is increasing. So what are the peculiarities of healthcare market? The first one is ethical and equity considerations. The society regards healthcare as an entitlement or a right and is reluctant to ration is solely by price or income, unlike other goods and services. And this is because in healthcare, human life is involved, and you know that you don't joke with human life. And this inevitably raises ethical issues. Therefore, you can appreciate that unlike other markets, healthcare costs must take consideration of the human life involved. You don't say because someone is your as a healthcare provider. You don't say that someone comes from your family, now is your family member, and maybe that person is suffering from more complicated malaria, and you have someone that is dying, that is just brought into the A and E department. You now say because you have a relative now, you not take care of the person that has the highest priority. Not in nursing, we deal with priorities. So ethical and equity consideration, there should be equity in whatsoever we are doing. We should not be biased. We should not be biased as healthcare workers. Now, another one is asymmetric information. Healthcare providers, particularly the physicians, the doctors, they possess the information and knowledge concerning details of treatment and diagnostic procedures patient need. While the buyer, that is the client, they have little information concerning this. Even we nurses, not only the physicians, we nurses too. We know a lot about our patients. And there's some information that we need to share with them so that they will know how to prevent what occurred to them, what has occurred to them, how to prevent it in future, or to know how they will be catering for themselves. But instead of us to spill it out, to let them know what is happening, we not do that. We keep it to ourselves. Even though there is what we call in ethics in nursing, there is what we call confidentiality. Still, is this your patient you are revealing the information to, not the relative. So we should not be keeping information that is crucial for our patient. We should not be keeping them to ourselves. The providers who in this context, they are the supplier dictates what the patient should consume. Instead of them to tell the patient that, let me give us an example now. Let's say in a primary health center, let's say in a village now, a patient comes to the primary health center for treatment. Now you want to treat malaria for the patient, uncomplicated malaria. In your hospital, and you don't have medications, or let's say you have. Now instead of you want to add antibiotics to the medications you are prescribing for the patient. Instead of you to write drugs that are not cost. For instance, now let me say amoxicillin. Now you are now writing amoxicillin for your patient to buy. Instead of you to give the patient options, these are what are available, these are what you can get. But instead of you to do that, for the patient to make consent, for the patient to make this informed decision by him or herself, you refuse to do that. So that is another peculiarities of healthcare market. Now, the consumer is not the one in the position to determine what the patient should buy, the patient to ask for. So the result of this asymmetric information is supplier-induced demand. You are the one that is demanding for your patient. You are the one that is inducing your patient demand. You do not allow them to choose for themselves. So in simple terms, most providers dictate to the patient what they have to spend money on to take care of their health, which should not be so. Now, another one is spillover effect. The service that is being received by the patient, sometimes they generate a spillover effect in which not only the consumer benefits from the healthcare someone recovered, but also a third party. If majority of the population are immunized against a disease, so let's say for instance now, hepatitis B. If your patient has been immunized against hepatitis B, is given HPV vaccine, the transmission of this hepatitis B will reduce significantly. And even those that are not vaccinated, they will not get the chance of being affected, or being infected, or being affected by this disease. That is so, and by or being affected by this disease that others are immunized against. So now, the fact that the people receive medical care when they are ill and return back to work, it also help in productivity. These people they will become productive to make a third party benefits from their recovery. Now, someone that is sick now, let's say let me give us an example now. In a ward, let's say a nurse is sick, and the person is unable to go to work, is on sick leave. This work will be on other nurses on the ward. Someone that is where, especially where they are short-staffed. They might be doing double shift. But once this person is okay, this person is not sick again, this nurse has come back to the ward, has come back to work now. This will relieve those people that are those nurses, those other nurses that are doing double shifts, and they will go back to their normal shift. That is another one. That is the fact that people receive medical care when they are ill. It also help these people to return back to work in order to relieve other people's, to relieve the third party that are helping them to do their work. And a healthy labor force is more productive. Yes, I've said that earlier. They contribute to the general prosperity and well-being of the society. So this has brought us to the end of study session 3. So I would love us to move to study session 4. And at the end of that, if you have any question, additional clarification, I will give room for that then. So let us kindly move to study session 4. I hope you can all see the slide. It's now displaying study session 4, introduction to budgeting. Please, if you can see it, please let me know. Introduction to budgeting. Thanks so much, Mercy and Juliana. Okay, thanks so much. So let's continue. Talking about budgeting, we all know what this means. That is, when we say we budget, you all say it every day. I have to budget this. I have to budget what I have in my account, so that I will not overspend it, and so that I will not spend more than what I want to spend. When we hear the word budgeting, so every health organization is involved in budgeting, including the hospital. There is no how there will be an organization and there will not be what is referred to as budgeting. Organizations, they up. Hello, can you hear me, please? I think this network is unstable. Please, can you hear me? Okay. Okay, thanks so much. Let's proceed. I've seen your message. Thank you, Moyo. Sorry, Fatima. I'm very sorry for that short break in transmission. I'm sorry, please. Let us proceed. Organizations budget for their humans and material resources. An organization does not only budget for the human resources, they also budget for material resources. Nurses, with nurses particularly, At the managerial level, we need to be familiar with the principles and process of budgeting. In nurses, because let me say, I don't know, maybe it's because nursing profession is being dominated by females. We thank God now there are many male nurses. So in fact, kudos to us for that. And those male nurses they are very active and they are working the way they are supposed to be. So I think that is what is triggering we women. So that is what is stimulating the females among the nurses. We females among the nurses now. So we need to familiarize ourselves with the principles and process of budgeting. Budgetary leaders, they inspire proactive fiscal planning, determine resource needs, guide visioning of justification from resources, and negotiate for needed resources. When we hear the word budgeting, some people will say that it is planning, even though it is more than planning. I would say that it's the process of creating a financial plan. That is, and this financial plan, it outlines how an individual, how an organization, how government intends to allocate resources over a specific period of time. And it also involves estimating income and expenses in order to guide financial decision making. Now, at the end of this study session, we should be able to describe the concept of budget, also to be able to explain various types of budgets and advantages and disadvantages of budgeting. Now, what is budget? I put it down here that it's defined as a quantitative statement that is usually in monetary terms of the expectations of a defined area of the organization over a period of time in order to manage financial performance. And I said it earlier that budget it can also be referred to as a financial plan. Is the process of creating a financial plan for an organization, not even for an organization, for an individual, also for the government. In order for them to be able to allocate their resources over a period of time. It's that the plan that this individual or the organization intend to allocate their resources, either human resources or material resources for a specific period of time. So the results of budgets are expressed in quantitative terms, and they're also associated with financial statements such as revenues and expenses. I've said that earlier. Now, what are the basic concepts that are related to budgeting? Yeah, we'll be talking about budgeting itself that are related to budget. Now, we're talking about budgeting itself. That is, which is the process of planning. You want to plan the future operation of your organization, the future operation by comparing the actual results with planned expectations. Now, the other concept is controlling. You want to compare. When you are controlling, when you see the word controlling, please let us take note of all this. When you see the word controlling, it is the process of comparing the actual results that you got with the results projected in the budget. That is, the result that you got, maybe you think you budgeted it in January. From January 1, you in the organization said that at the end of this year, by the end of this month, that is by January 1, no, this is what we plan to achieve in this organization. And by that January 31st now, you now want to see, you are now comparing the results you got, the actual results at the end of that January with the result that you have planned, you have projected. Someone is raising a hand. Please. Let me see, who is that person? I hope you can all hear me, please. Can you now hear me? And I also hope you can see the slide that is displaying. It's displaying basic concepts related to budgets. Thank you. Let us proceed. Now, The next one is incremental budget, and this incremental budget is also referred to as line by line. That is another name for incremental budget. It's also called line by line budget. And this is a budget worksheet listing expense items on separate lines. That is, you list your budget line by line, as the name implies. And this is divided into salary and non-salary expenses. Now, let us move to so talking about this line by line budget, it is the worksheet that are used here. The worksheets that will be used there may include several columns for the amount budgeted for the current year, the amount actually spent year to date, the projected total for the year based on the actual amount spent, also increases and decreases in the expense amount for the new budget, and also the request for the next year with an explanation attached. That is what the worksheet may include. Now, the line by line budget, it has advantage of simplicity. It is not hard, but the disadvantage is that it discourages cost efficiency. So another concept is zero-based budget. Zero-based budget is budgetary approach that assumes the base for projecting next year budget is zero. Now, let's say this is December now. Now you want to start budgeting the operations in your organization towards next year. For next year, the organization zero the mind. It zero its mind that there is nothing in the organization for that year. You zero, there is the budget. You plan that what occurred in the previous year is zero. Now you want to assume this year's. You want to start with this year's budget as if there is nothing on ground, that nothing has occurred before in the organization. That is zero-based budget. And managers, they are required to justify all activities and every proposed expenditure, regardless of the level of expenditure in previous years. Every expenditure for the new year must be justified in view of organization's objective and current environment. Whatsoever you are planning, whatsoever expenditure you plan, whatsoever money you plan to spend in that year, you must try to justify it with the objectives, with the aims of the organization and the current environment of that organization. Another one is fixed budget. A fixed budget is budgeted amount that are set regardless of changes that occur during the year. Whether there is increase in the volume of the patients on the ward, either there is an unanticipated inflation, either the volume of patients on the ward has increased, the hospital borrowed the hospital will not change the plan for that year. What the hospital has planned since January, now this is what you are planning to get. Let me say, maybe the hospital budgeted is that for this year, the only equipment we are going to buy, for this year is let me say the hospital plan that let me put it like this. The hospital plan is that no matter the situation this year, we are not going to recruit any staff. There is no recruitment in this organization for this whole year. And along the line, maybe they made that budget in, let's say the organization made the budget in January, and in May there is increased volume, there is volume of patients coming into the hospital. Maybe because before in a month they used to have like 200 patients in a month. Now they are now having 500, 600 patients for a month in a month. No, there will be work overload for the staff that are working in the hospital. And the HOD of each unit will be going to maybe the HOD of each unit are now visiting. These HODs are now complaining to the organization, to the admin, that my staffs, they are breaking down. My staff are breaking down from work overload. But because admin has planned, they have budgeted this from the beginning of the month, that no matter what is going to happen in this year, there will be the budget will be fixed. That is what fixed budget meant. Now variable budget, that is the opposite of fixed budget. A budget developed with the understanding that adjustments will be made to the budget when will be made to the budget if there is, based on changes in revenues, based on changes in patient volume, based on changes in utilization of supplies and other expenses in the hospital. That is what variable budgeting. That it is the opposite of the fixed budget. And the next one is fiscal budget. That is a specific 12-month period during which operational and financial performance is measured. That is, it is a fixed month period. That is from, let's say, from January to December. It may not even be from January to They may choose it as from this year June to this year, from this year July to next year June. It's a 12-month period. It is operated within 12 months. That is what fiscal budget means. That is a specific 12-month period during which operational and financial performance is measured. Hello, I hope you can all see the slide and also hear my voice, please. Can you all hear my voice? Now, talking about types of budgets now. Yeah, I put it down that there are five major types of budgets. Operating budget, personnel budget, capital expenditure budget, cash budget, and flexible budget. Thank you, Awolola. Thank you, Anogutude. Thank you. You can all see my slide. Thanks. I'm grateful. I'm grateful. So now let us be taking this slide, this budget one after the other. The first one is operating budget. What do we all mean by? What do you all understand by operating budget? This operating budget refers to as revenue and expense budget. Revenue and expense budget. You can also call it annual budget. Please let us be taking notes of all these key points. I hope you can understand me. I hope you can all get me. Let us all be taking notes of this point as I'm explaining them to us. You know, you have to do both CBT and written questions. So let us be taking notes of this point as I'm mentioning them. The operating budget is also referred to as revenue and expense budget, or we can also call them annual budget. There are three names for operating budget. The first one is operating budget. You can call it revenue and expense budget. You can also call it annual budget. Here, I said that the operating budget is the organization statement of expected revenues and expenses for the coming year, and it's concerned with the fiscal year of the operation, which in the public sector in Nigeria corresponds to the calendar year, January to December. I hope you can all hear me, please. Please, can you all hear me? The operating budget reveals an input-output analysis of expected and revenues and expenses. And it's also a detailed projection of all estimated incomes and expenses that are needed to run the day-to-day activities of an organization over a specific period. That is, this operating budget is what is being planned in an organization, that this is how we want to be running, how we want to be running this, how we want to be spending this expense, doing this in the organization, how we want to be running the organization day-to-day activities, but it's over a specific period. And also, it's usually one fiscal year. When you hear one fiscal year, it means in Nigeria calendar is referred to as January to December. Please let us take note of this. Now, the operating budget reviews and input and output analysis. I've said that earlier. The revenue budget for a nursing unit may represent the patient care income expected for the budget period. So, and this SY budget consists of salary and non-salary items. Now, let us move to the second budget, which is personnel budget. Personnel budget it estimates the cost of direct labor necessary to meet the agency's objectives. That is, the aims of the administrators. The personnel budget is the one that will help to estimate the aims, the objectives of the administrators, and to meet that of the direct labor. The direct labor necessary, that is the cost of direct labor, how it will meet with the agency's objective. That is what personnel budget is all about. It involves this is required in order to guide how the organization wants to be recruiting, how they want to lay off. Maybe in that year, maybe they plan it that in case there is no market for that whole year, in case there is a reduced number of patients that are coming to the hospital that visited the hospital for that year, that is, if there is reduced number of the patients that will visit the hospital during so period, this so time, that means we have to lay off some of our staffs. Also, the discharge personnel. That is what personnel budget is all about. In developing the personnel budget, the nursing manager needs to determine the level of need of nursing care that will meet the need of estimated patient population in its unit. In a word now, if they are short-staffed, the head of nurses there, we have to go to the head of nurses, to the DNS or the DDNS in that hospital, that please, we need this, and that this DNS, director of nursing service, will be the one to go to the administrators. They have to sit over it and talk about it, that in this ward they are short-staffed, they need this, they need that. Or even if there may be some units that they have, that where they have many nurses, and the work they do there is not, and they do not have much work to do on that ward. The head of nurses, the DNS may borrow some nurses, or may not even transfer them to the ward. They may borrow them and ask them to go and work, to go and do their own duty there for that shift. So another one is that the nursing manager will need to estimate number of the various cadres of nursing personnel that will be required during each shift, in what month and in each area. If you can all remember, they are all nurses. In some hospitals, like I don't know, in some teaching hospitals, the what do we call it? The rosters will be made. These are rosters. They have been made at least 2 weeks before the date. These rosters are made at least 2 weeks, so that the head of nurses will know how to plan it. Either if some wards are not covered, or if he needs to borrow some nurses to such wards, to such units for that period of time. Also, it has to manage the salary budgets that is directly related to the manager's ability to supervise and lead the staff. Also, another type of budget that we'll talk about is capital expenditure budget. Hello, I hope you can all hear me, please. Please let me know if you can all hear me. And also, I hope you can see the slides that are displaying. Okay, thanks so much. I'm grateful. Thank you all. When we hear the word capital expenditure budget, The capital budget is an important component of the plan to meet the organization's long-term goals. There is no how you want to plan, you want to budget in an organization that you not add the capital expenditure to it. There is no how, because what do you want to use to achieve your plan? What do you want to use to achieve your objective without money, without money, without capital? Capital expenditures include physical changes such as replacement or expansion of the plant, major equipment, and inventories. Organizations define capital items based on certain criteria, must have an expected performance of at least 1 year or at least cost of minimum of certain amounts, like equivalent of $500 or $1,000. So talking about capital expenditure, the capital expenditure budget, it is a financial plan, I've said it earlier, that helps to estimate the cost of acquiring, upgrading, or maintaining long-term assets of an organization. Usually, administrators, they establishes ceiling for capital budget, and the nurse manager will need to prioritize requests if the request exceed the available fund. For instance, now let's say you need some inventories in your ward. Let's say let's use input and intake and output charts. Now you don't have many of it on the you have none of it on the ward, even in the whole hospital. There's no how you want to achieve this without going to the administrator, for the administrators, for them to know how to get it for the hospital. So unfortunately, in many developing countries, nursing managers are hardly involved. I said this earlier. We nurses, we are hardly involved in capital budgets, which is supposed not to be so. We're also part of the hospital. Our organs, our DDNS, our ADNS, they should be part of budgeting in their facilities. And this is taken up by hospital administrators alone, at those hospital administrators that are at higher level, though with some inputs from nurse managers in form of selecting and determining the number of equipment that we need in the hospital, in the ward. We need to be actively involved in this. So the next one is cash budget. Cash budgets are planned to make adequate funds available as needed and to use any extra funds profitably. You don't just spend money anyhow in an organization. Any money you want to spend out, that means it has to be profitable. In an organization, if we spend money out, we are spending funds without profits. That is a loss. It is a loss. The organization is at loss. So that if you want to spend any cash in an organization, you have to budget it. That this is what we need this for. Let's say they want to get let me say ultrasound machine. Ultrasound machine. You sit down. The organization, the leaders in the organization, the administrators, not only them, with the nurses and the physicians and all other professionals in the hospital, you sit down and plan it. This is the amount you want them to be doing abdominopelvic scan. And if it is only abdominal scan, this is how much you want them to be doing it. If it's only pelvic scan, this is the amount they should be doing it. You are doing this in order to make the money the fund you've already spent, in order for it to be profitable. And cash budget ensures that the organization during the budgetary period has enough, but not too much cash on hand. And this is necessary because incomes do not necessarily coincide with expenditures, and also seasonal variations should be anticipated, which result in fluctuations in resource needs. Also, if there is insufficient cash on hand, purchase of needed resources will be hindered if cash budget is not done. if the organization do not budget, if they do not budget how they want to spend their cash, and they spend much time without planning on how to make profit from it, and at the end of the day, there is no more money in the organization. All the resources that will be needed in such organization will be, the purchase of such resources will be in that. So if the budget is well planned, this will provide cash as needed, and will also provide interest on excess fund. So the next type of budget is flexible budget. If you can remember, we made mention of variable budgets when we were talking about the concepts of budget. So flexible budget means that if there is any changes in the organization, the budget too will change. That's just it. If there is any change in the organization, the budget of that organization changes too. Some expenses are unpredictable, and they can only be determined after change has commenced. Because of this, it is necessary for the organization to have flexible budgets. And the changes can be compensated by having periodic budget reviews. Sometimes variation in cost can be predicted through historical analysis of costs in previous budgets. You want to make variation based on you can also remember variable budget is the same thing as flexible budget. Sometimes variation in the cost of healthcare can be made if the administrators can predict what happened in previous year. They can use what happened in previous year to predict what will happen in the present year or in the future year. So attendance of health facilities in many places in Nigeria, they drop significantly during festive period. During festivities, and in some cases, attendance of clinic is higher soon after workers receive salaries. Yes. Your budget has to be, an organization needs to have what we know as flexible budget, because sometimes, especially during festive period, the number of people that will come to the hospital, especially in this our country, Nigeria, they are not many. It's only after that festive period that you not be seeing people coming down with diarrhea, coming down with cholera, coming down with many other GIT diseases, because of what they've taken during the festives. And also when the government workers, and even those that are not government workers, when they receive salary, there are increase in numbers. There are increases in numbers of people that visit the hospital. Many people will come for checkup. Many people will come for treatment. And this form of variations require that budgets are made flexible. Now, what are the advantages of budgeting? Budget plans for detailed program activities. That this is how we want our programs to be during this period of time. It also helps to fix accountability by assignment of responsibility and authority. Once the organization is making a budget like this, when the organization is budgeting like this, they try to make someone to be responsible. See, each head of the unit, each head of the ward will be the one to account, will be the one to be responsible for this so that have been sent to their unit. So it's really meant to be accountable for this assignment that have been assigned to them. Also, it helps the organization to set goals for all units. I've said that. It's also to offer a standard of performance and to strengthen the nature of the planning and control process. We talk about the controlling when we are talking about the concept of budget, when we made mention of controlling. That is, it is the one that we use it to compare the actual results with the objectives of the organization. Now, budgeting also encourages managers to have careful analysis of operations and also to base decisions on careful consideration. It also helps to minimize hasty judgment in decision making. You don't just make decision. before an administrator will work hard, they have to go back to their budget to see what they have planned, what they have budgeted for the organization for that period of time. Also, another advantage of budgeting is that it exposes organizational weaknesses. It also allows for corrective measures to be taken in such organization. It also budgeting it also helps resources to be projected and waste will be minimized. Also, financial matters can be handled in orderly fashion, and activities of organizations can be coordinated and balanced in such organization. Now, what are the disadvantages of budgeting? The first one is that only the aspect of organization activities that are easy to measure will be the one to be considered in budgeting. Only the parts of the organization activities that are easy to measure, they will be the only one that will be involved in the budgeting, which should not be so. Another advantage is that budgeting may become an end in itself instead of a means to an end, particularly, especially in situations where symptoms are treated as causes. It is important to find out the underlying reasons for the symptoms. Yes, where our patients are being, somewhere where a patient is being treated on the ward, instead of us to notice to know the reason why this patient is suffering from this disease. You know that as nurses, we want to treat our patients. What do we use? We use holistic approach. We use holistic approach to treat our patients. That is, be it we go through the mental state of the patient, social life, the physical state, psychological state, spiritual aspect of that patient. If you want to treat your patient, you are treating, but in order to do this, you may be affecting the budget of the hospital, because let's say that maybe in your hospital, they have like just 2 patients on, just like 4 nurses on the ward, or let me say your ward is like 4-bedded ward. Now you have your ward is 4-bedded, and you have patients that have you have 4 patients on the ward already. And your hospital expects you, the organization expects you to treat these patients on time and discharge them early, so that you will be able to admit another patient on the ward. And there is this woman that has a child abroad, and you've been taking care of this woman for a very long period of time. And the woman, there is no changes. When you discharge the patient today, they will still bring her next week that she's sick. Or let me use this. Let's use the example. Let's just relate it to primary health center. Let's say maybe this woman just has a child, and the child has been overseen, has been living in USA since for over 10 years now. The woman has not seen him. The child is just sending money. You know, psychologically, the woman might be affected by this. Maybe you ask her that, let me know what is happening. But because you did not ask for the reason why this woman is being like this, why this woman, you do not treat your patient holistically, because you want to make money for the hospital. You want this woman to go, and maybe if you come back the next time, you see you have money to collect for the hospital and other patients, in order to attend to other patients on time too. You not go deep. You not go deeper. You not ask enough questions. You not be asking your patient what you are supposed to ask them, in order to get the reason why this woman is sick all the time. You just treat her physically. You do not treat her psychologically, emotionally. You do not use holistic approach in treating such patients. So here we have to treat our patient. We know that we nurses, we treat patients holistically. But because the body in your facility budgeted it that at the end of this week, we should be able to make so amount and you want to achieve that, you want to achieve what you planned, what has been planned at the beginning of the week. Now you are not rushing, you are now rushing yourself in catering for your patient. Another disadvantage is that budgetary goals may sometimes supersede the organization's goals, and it may gain autocratic control of the organization. Another one is danger of over budgeting is that it make the budget cumbersome. Danger of over budget, if you over budget, if an organization over budget what they plan, what they want to occur in that organization, it may cause budget, it may make the budget to be cumbersome and expensive. Another one is that budgeting is time consuming and expensive. Another disadvantage is that it requires skill and experience for successful budgetary control. And also it requires forecasting, but it can be uncertain because budgetary control is subject to human judgment, interpretation, and evaluation. So this has brought us to the end of this study session too, and to the end of the lecture. So to recap what we've been saying, we talked about the budget. We said that we can say that it is the planning that is made in an organization in order to achieve certain in order to achieve the objectives of the organization. Now we also say that there are like 5 major types of objectives, or there are 5 major types of budget, talking about operating budget, flexible budget, personnel budget, capital expenditure budget, cash budget, and I think those are the 5 budgets. And also we talk about the advantages and disadvantages of budgeting. And I also told us that another name for operating budget is revenue and expense budget, or we can also call it annual budget. So please, if you have any question to ask me, question, addition, question, clarification, kindly let me know, please. Thank you. I'm grateful for your survey and sign up. Thank you, Ade Akambi. Thank you, Felicia. I'm grateful. Thank you, Mercy. So if there is no question, in the absence of any question, so please, I would love to ask my own question. So can someone tell me? I would love you to tell me another name for operating budget. What is another name for operating budget? You are highly welcome. Thank you, Muhammad Miriam, annual budget. Thank you, Owoju Adenike. Yes, people are responding. Yes, you are right. You are correct. Yes, revenue and yes, revenue budget. Yes, you are right. It's not expensive, oh. Please, Adiza Lawa, it's not revenue and expensive budget. So please don't make that mistake in exam. It's revenue and expense budget. Please take note of that, Adiza. Revenue and expense budget. Thank you all. Yes, that means you've all been following my lecture. I'm grateful for that. Thank you. So what are the two major types of cost? The 2 major types of healthcare costs. The 2 major types of healthcare costs. What are those 2? What are the 2 major types of healthcare? Thank you, direct and indirect. I'm grateful. Thanks so much. I'm really grateful. And this has brought us to the end of today's lecture. Thank you. Thank you so much. I'm grateful. Thank you all. I'm grateful too. Thank you. Thanks for enjoying the lecture. The next time that we will be meeting, please do stay safe. Please stay safe. Bye-bye.